Hello and Assalamualaikum everyone. So today we're gonna learn about osteomalacia. Osteomalacia, or known as softening of the bones, it is a condition where our bones become soft and weak, and it will make our bone easy to bend and break. There are several methods that the doctor will diagnose the patient with osteomalacia, which is the doctor will make a physical examination, review of symptoms, and do some diagnostic tests such as blood tests, urine analysis, X-rays, and bone biopsy. Not to forget, osteomalacia may develop because of a lack of vitamin D. Either it is from food or sunlight exposure. In children, this condition is called rickets.
Incidence and prevalence of osteomalacia. The incidence of osteomalacia is approximately 1 in 1,000 people. The true prevalence of osteomalacia across the world remains unknown because the condition is often asymptomatic, which is showing no symptoms in most cases, especially in elderly. However, vitamin D deficiency is by far the most frequent cause of osteomalacia on a global scale. Based on the one-of-all bone biopsy study, Hodron and Pico examined 78 unselected patients, which are 68 women and 10 men at the time of an acute proximal femoral fracture, and found that the prevalence of osteomalacia increased with age. It happened in 29% of patients over the age of 90. Limited finding from Malaysian-related studies, however, deficiency in vitamin D was seen in 78.9% of participants, which involved young adults in Peninsular Malaysia.
The next is etiology. The first is vitamin D deficiency. Vitamin D helps maintain the calcium and phosphate levels to help the bones form properly and stay healthy. They are made within the skin from exposure to sunlight. Second is surgeries. Surgical removal of a part of the small intestines or stomach can cause problems absorbing vitamin D, leading to vitamin D and calcium deficiencies. Third is kidney or liver disorders. Kidney and liver problems can impair the body's ability to make active vitamin D to be used by the body as the body activates vitamin D through these organs. Next is drugs. Drugs that treat seizures like phenytoin or phenobarbital can lead to severe vitamin D deficiencies and osteomalacia. The last is celiac disease. People with this autoimmune disorder are sensitive to gluten, which can cause damage to the cell linings of the small intestine. It interferes with the small intestine's nutrient absorption process, leading to vitamin D and calcium deficiency. Pathophysiology. Osteomalacia occurs because of the decrease or deficiency level of vitamin D. It causes the decline in calcium and phosphorus absorption by the intestine, and it will lead to the low level of calcium, or known as hypocalcemia, and low level of phosphate. It will result in continuous loss of calcium and phosphorus to bone, and this will lead to the impaired bone mineralization in sponge and compact bone. And after that, it will cause the softening of the bone, or known as osteomalacia.
Clinical feature of osteomalacia: pain felt in the bones and joint, muscle pains and weakness. Bones can break more easily, especially in the hips, lower back and feet, muscle cramps, and walking with waddling gait. Conservative for osteomalacia: the first one is adequate diet with vitamin D, taking therapeutic dosage of supplements such as vitamin D and calcium. Some people may require braces to correct bone deformation. And the last is getting regular exposure to sunlight.
Next is surgical management. The first surgical management is corrective osteotomy. It is a surgery that cuts bone to restore more normal alignment. Corrective osteotomy that has been done on the hip and knee can realign the leg and improve gait and as well as reduce pain. Second is excision of causative tumor. This type of surgery is usually for tumor-induced osteomalacia patients. The third is fixation with external fixators. Osteomalacia patients frequently experience fractures on their bones as a result of bone weakness and softening, which makes their bones easily bend and break. So these external fixators are used to keep fractured bone stabilized and in alignment. The device can be adjusted externally to ensure the bones remain in an optimal position during the healing process. Okay, next is by using intramedullary nail. Plates and casting, including epiphysiodesis. An intramedullary nail is a metal rod that is inserted into the medullary cavity of a bone and across the fracture in order to provide a solid support for the fractured bone. It is commonly used to treat fracture at long bone such as femoral shaft fracture. Last is by using cashless wires, or also known as K-wires. K-wires is a straight wires that are sometimes needed to repair a fracture or broken bone. K-wires will help to hold the bones in place until they heal.
Prognosis: most people with osteomalacia will recover with treatment, often involving a course of vitamins or mineral supplements. However, it can take months for bones to recover and for muscle to become strong again. A late diagnosis can make recovery more difficult, especially if bones have fracture.
Impairment and functional limitation. For the impairment, the patients may experience decrease in muscle tone, leg weakness, feel pain as well as limited range of motion. Okay, next, because of the impairment, the patients may undergo several limitations such as difficulty of functional mobility, difficulty to perform ADL and IADL activity independently, and last, she or he may need assistance from others to lift large items. In terms of participation restrictions, the patient is unable to perform leisure activity independently. The patient also have a limited involvement in social activities such as family gathering. That's all from us. Thank you for listening.